Imaging is very important in the things that we do. The better the imaging is, the lesser mistakes we make, and the lower the complication rate will be.
To avoid problem as well, it's really important to have good imaging.
I think really the most important thing in complex aortic surgery is trying to make it as simple as possible.
We actually are able to do more complex procedures now, such as branch cases for aortic arch aneurysms or dissections. It's really easy to get the images you want if you do the manipulation by yourself.
The C-arm really goes where you want to go with an easy movement of the joystick. And with the table-mounted touchscreen module, all functions are really integrated at the table. The flex arm delivers a really outstanding image quality.
Probably the biggest advantage that we've seen with this new system is a massive reduction in the radiation required to get very high quality imaging.
To be self-confident, I think the most important thing is to have a good planning, so to think about the case beforehand and before the procedure. What I like about AVA is that it's a simple program, it's very simple to use and very quick.
The EVA software helps us in defining the treatment plan, and it helps us to plan and to size the endograft for the patient.
The thing is, we have to detect the ostia of the target vessels. Vessel navigators permit us to display the ostia of target vessels very reliably and with a great accuracy.
So we use the vessel navigator in combination with the marker tool during the complex fenestrated cases and branched cases to locate our target vessels.
We have a lot of problems of renal insufficiency. And with that sort of system, with the use of fusion images, we can reduce the amount of contrast. The clarity IQ system that permit us to diminish the doses.
We've definitely learned that less time on the operative table is a good thing for patients. And I think all of these advanced imaging features try to achieve that goal of decreased time for surgery.
Most of the cases at the end of the procedure we use cone beam CT without contrast to detect any stent abnormalities of the bridging stents or the iliac limbs.
If you use contrast, you have additional information such as endoleaks. And in that case, you can, for example, skip the 1 month post-op CT scan.
This hybrid OR offers us outstanding image quality with a low radiation dose that is very flexible, very intuitive. It gives us confidence in the things that we are doing, and it improves the accuracy, and in this way it decreases the complication rates.
At the end of the day, we're trying to make procedures safer for patients. And I think all of these imaging solutions allow us to make the workflow easier, to make the procedure more straightforward, to decrease operative time. And all of those things, I think in aggregate, make outcomes better for patients.